Get physical with great rates at the Al Hikmah Sports Hall in Batley. You can book a weekday daytime slot for just £18 per hour. Call 01924 500 555. Evening or weekend slots for just £38 per hour. And special discounted weekend slots available too. Call 07968 222 886. The Al Hikmah Sports Hall, the perfect place to get back in shape. It is related by Sayyidina Anas radiallahu anhu that the Prophet Muhammad sallallahu alayhi wasallam said, when a man marries, he has completed half of his religion, so let him fear Allah regarding the remaining half. The Al-Hikmah Nikah service launched by the IMWS aims to introduce prospective marriage partners to help fulfill this important aspect of faith. The service is open to unmarried Muslims who are permanent residents of the UK. For more information, visit our website at www.imws.org.uk.
Radio IMWS.
Assalamu alaikum wa rahmatullahi wa barakatuh. You are listening to Radio IMWS, broadcasting live from the Al Hikmah Centre. I am Safeeyah and this is Safeeyah's Hour. Now, today I have some guests with me from Dewsbury Hospital to discuss the changes for children's services and the maternity unit at Dewsbury Hospital. Do remember, if you have any questions or you have anything you'd like to say, do ring the studio hotline on 01924 505 629 or WhatsApp and text us on 07460 809 218. Right, to begin with, I'll just go through the facts and do correct me if I am wrong. The A&E will be available 24/7, but if you need specialist treatment, you will be transferred to Pinderfields. You will be able to have an operation at Dewsbury if you need a routine planned operation. Dewsbury Hospital aims to expand the range of surgical specialists that will be available at Dewsbury and plan to upgrade theatres. However, patients who need complex operations and potentially require intensive care or high dependency support will have their operations carried out at Pinderfields Hospital. More people will be treated at Dewsbury, as this will be the main centre for planned operations and day treatments. And you will be able to have your baby at Dewsbury. A new midwife-led unit will be opening. Dewsbury Hospital will have highly trained midwives that will provide a quality service to all mums expecting a normal delivery. And Pinderfields will provide services for you and your baby if you need specialist care. These changes will be discussed in detail by our guests later in the show. But to start with, let's discuss the changes to children's services at Dewsbury. Firstly, I'd like to welcome Dr. Allison Grove, a paediatrician. Hello.
Hello.
Sue, from the Children's and Neonates Department.
That's right, yes. Hello.
Hello. And Caitlin, consultant midwife.
Hello.
Hello. And in the back, if you're watching us live on YouTube, we have Chitra, a consultant obstetrician. It's like a new language for me. And we have Catherine, a consultant obstetrician, gynecologist.
That's right.
Hi. And do remember, you can ring us on the hotline or WhatsApp and text us. Right, so if you could please tell us about the changes that have happened so far that began on the 11th of August 2014.
Yes, speaking of children's, the first stages of the centralisation of inpatients began in August 2014, and that was the opening of the 24-hour assessment unit that's been really successful at Dewsbury, and that was the first stages. And also the neonates was the babies that require special care. They were all nursed on the unit at Dewsbury, and the babies who required HDU care or ICU care was nursed at Pinderfields, and that was the first stages of this the centralisation of inpatients.
Okay. What still needs changing?
So we're now ready for the second stages, which will involve the assessment unit going from 24 hours, which it is now, to 12 hours. So that will mean that the opening and closing times are 10 a.m. till 10 p.m. So any children that require an overnight stay would then be transferred to Pinderfields Hospital. So the assessment unit will still be there. So children will still receive treatment at Dewsbury, but some children who require an overnight stay, which is a small number, will go to Pinderfields. And neonates will move to one unit at Pinderfields, which enables us to give all neonates then access to specialised nurses and specialised consultant care. So there will be no neonates at Dewsbury.
Right. How has this benefited families and children, and of course the hospital itself?
The hospital itself is part of the centralisation, so that all children and all neonates would get access to consultant care 24/7 and specialist nurses and specialist services. So that small amount of children who need that specialised care, who need to stay overnight, or who need surgery that requires them to stay overnight, they will have access to all that in one site. But the children, and that's the majority of children who require a small time for observation or need treatment or day surgery, planned surgery, will still receive that at Dewsbury. So that enables us to give the children access to the right skilled practitioners, which includes nurses and doctors, in the right place.
Are there any disadvantages to these changes? I mean, have you had many complaints?
The disadvantages which comes with any centralisation really is that for that small amount of children who require an overnight stay at Pinderfields, does require the parents to travel. Because it is further than the Dewsbury Hospital, and so the majority of children will still be seen at Dewsbury, but that small amount, it does include travel, so that is a disadvantage. But that does come with all centralisation, unfortunately.
And parking isn't cheap at Pinderfields. I have experienced, and when you walk in, it's like you're at a train station.
Yes,
massive.
Yes, you can park. That's the advantage. Is there's always a parking space. It is expensive, but when you when you stay overnight on a children's ward, you get a ticket, so you get a reduction in that car parking cost.
Okay.
So that is a good point you brought up, really, because they need to speak to the nurse in charge, and they will get a reduction in that cost if their child has to stay several nights in hospital.
Would this be the same for anyone going for maternity or any other reason if they've had to stay overnight?
I would have to ask my colleague to answer that. That
Yes,
does happen
yes,
in
we do.
children.
Yeah.
Yes.
Great. Is there anything else you'd like to add about children's services?
I don't know if my colleague Dr. Grove would like to add anything.
Okay. I think to say that the Children's Assessment Unit, we've had a lot of good feedback from children and families since it opened. The Children's Assessment Unit isn't a walk-in unit. It's a referral unit for people to be referred there by their general practitioner or by A&E staff or by health visitors or midwives. When children are referred in, the person referring the child in will have a direct conversation with a senior paediatrician who will make a decision about where and when is the best place to see that child. Now, it may well be on the assessment unit at Dewsbury. It may be for the small number that need overnight admission or a longer admission to be seen at Pinderfields. It may be if a child's referred late on in an evening with something that doesn't need to be seen straight away, that we can arrange to see that child the next day or in an urgent outpatient clinic, and we're increasing our outpatient appointments for that. But children that come to clinics, so outpatient clinics, will still continue on all of our 3 hospital sites for children as before. So there's no reduction in any of that or access to that.
Right, thank you. Do excuse all the noise, listeners. We've got like a massive wedding going on outside and we've opened the windows. But if you could just bear with me, we'll go for a quick break and we will be back in a moment. Do remember you can ring the studio hotline on 01924 505 629 or WhatsApp and text us on 07460 809 218 if you would like to join the discussion or you have any questions or worries. We will be right back.
Broadcasting from the Al Hikmah Centre in Batley, West Yorkshire, you're listening to Radio IMWS. Are you running a business from home and need to move into an office, a place where you can confidently meet your clients, or maybe looking to relocate? The Al Hikmah Center provides office space in a safe, secure, and scenic location. With easy access, convenient location, free car parking, and free Wi-Fi, hiring an office at the Al Hikmah Center can allow your business to grow. For more details and special offers, call 01924 500 555 or email info@imws.org.uk. Get physical with great rates at the Al Hikmah Sports Hall in Batley. You can book a weekday daytime slot for just £18 per hour. Call 01924 500 555. Evening or weekend slots for just £38 per hour, and special discounted weekend slots available too. Call 07968 222 886. The Al Hikmah Sports Hall, the perfect place to get back in shape. It is related by Sayyidina Anas radiallahu anhu that the Prophet Muhammad sallallahu alayhi wasallam said, when a man marries, he has completed half of his religion, so let him fear Allah regarding the remaining half. The Al Hikmah Nikah service launched by the IMWS aims to introduce prospective marriage partners to help fulfill this important aspect of faith. The service is open to unmarried Muslims who are permanent residents of the UK. For more information, visit our website at www.imws.org.uk.
Radio IMWS.
Assalamu alaikum and welcome back. You are listening to Radio IMWS, broadcasting live from the Al Hikmah Center. I am Safeeyah and this is Safeeyah's Hour. Now, you can ring the studio hotline on 01924 505 629 or WhatsApp and text us on 07460 809 218 if you would like to join the discussion or you have any questions you would like to ask. So we're talking about children's services, the changes at Dewsbury Hospital before we went on a break. Now, what happens and what should parents do if their child is poorly?
So if their child is poorly, they would usually go see the GP, and the GP will have a conversation with the consultant, and that a triage will take place on where that child's best to go. So if the child is to go to Dewsbury, that will be arranged, or if it's the consultant feels that the child needs to go to Pinderfields because of maybe the time or maybe because of the condition of the child, then they will go straight to Pinderfields. If it's an emergency, then we will still advise that that you ring 999 and an ambulance will take the child to the right hospital. If you can't get in to see your GP and you need to attend, I think it just needs to be bear in mind that if you attend late to Dewsbury, there is a chance that you'll be transferred to Pinderfields because we won't be able to give you a period of observation. So because it's the opening times is 10 a.m. till 10 p.m, if you arrived at 9:30, for example, it may be that you have to be transferred to Pinderfields. So it may be that you choose to go to Pinderfields if it was at that time. I don't know if my colleague's got anything else.
I think if you're concerned your child is unwell, I think just to reiterate what Sue said, if you're concerned your child is unwell, your first port of call should be your general practitioner. And even if they're not available out of hours, contacting their surgery, they should have out of hours contact details or arrangements for you to be able to see somebody when the surgery is closed. There are other opportunities available, community pharmacists and things who can give you advice if you're concerned about minor ailments and minor things with your child. As we said, if your child is seriously unwell or has been badly injured, you should call 999. And that'll mean your child's taken directly to the hospital that can provide the best care for your child. But also ambulance crews are trained health professionals, so they can start any necessary treatment that's required for that child.
And there's also the advice line, the 111.
Yeah.
They will also give you advice if you are wondering what to do, depending whether it's a minor injury or an illness. They will give advice on where to go.
Yes, from personal experience, they do ask a million questions at
Yes.
the start,
Yes,
but
that's true.
they do get to the point at the end.
Yeah.
And they have actually been helpful because I rang up just after my daughter was born and something wasn't right with myself. And I rang that number and they got me in to see a doctor at the Dewsbury Health Centre straight away, which was brilliant because my GP said they were busy and they couldn't see me. So yeah, do contact them as well. Is there anything else?
No, that's all.
Okay, so we'll go on to talk about the maternity changes.
We're going to swap changes.
Yes. Yep, I'm having a quick swap over. So we have Chitra and Caitlin.
And Kath.
Catherine.
Yeah.
Okay, confused.
That's okay.
Everybody. Can I blame baby brain? Right. So what changes have taken place so far?
Currently, no changes have taken place within maternity. Dewsbury is still fully functioning as an obstetric unit, and our antenatal clinics and our community midwifery. So currently, nothing has changed yet.
When will these changes happen?
We're looking to begin the changes starting the weekend of the 16th of September. So from there, we will start making the changes for Dewsbury Hospital, and that will take place over that weekend. Lots of communication is going to be going out in the future through antenatal clinics and through leaflet drops to inform families of what they need to do over that weekend.
Right. And what are the actual changes?
So the actual changes that's going to happen over that weekend period and from then on there's going to be a consultant-led unit that will be based at Pinderfield. So the labour ward, which is consultant-led at Bronte Tower, will be moving to Pinderfields Hospital. But just like the children's services, other services that are still going to remain in Dewsbury, which is your antenatal clinics, antenatal day unit services, and our brand new midwife-led birth centre for low-risk mothers, that's going to remain in Dewsbury Hospital. So the main change is going to be those small proportion of women who need both midwives and doctors will need to go to Pinderfields Hospital because the labour ward, the consultant-led labour ward, is based there, and that will be from the weekend of the 17th of September.
Okay, so I read that if you've had a good pregnancy, then your midwife will most likely say you can have your baby at Dewsbury.
That's correct.
What if in a split second during labour something could go wrong? What happens then?
Well, what happens then is most of our midwives are trained in emergency situations. To be honest, most of the transfers that we do, and that's looking at both our statistics from Pontefract Hospital, because we have had a birth centre operational for 6 years at Pontefract. So we have lots of statistics from them and certainly have tested all of our policies and procedures. Midwives are very good at dealing with situations that may occur, and most women who actually transfer out of a midwifery-led unit or a birth centre do so because their labour is going more slowly. And that's not an emergency situation. That is a situation where we know that more help is going to be needed, and we can make those arrangements in a process that is neither stressful nor worrying for the parents. If there is a split-second emergency, which does sometimes happen, albeit very, very rare, the midwives are trained to deal with those situations, and we have policies and procedures in place to be dealing with those. And we have to remember that the women who are coming and the mums and the babies who do come to our birth centres are well and healthy, and so can have these situations happen with good outcomes. And we certainly know from national research that has happened that the outcomes for mums and babies have been very good on midwifery-led units.
Talking from personal experience, when I went into labour with my daughter, everything was fine. My waters broke at home, contractions were normal. I'd gone to the hospital, pain relief, everything was fine. I felt this urge to push. The nurse said, "Don't push yet, it can't be." She's gone out, come back. I had a look and realised I needed to push. In that time, they've lost the heart rate. They've had to rush out and get a doctor straight away to come in and take over. What if that happens to another woman, or say myself, if I was to have a baby at Dewsbury? What then? Will there be any doctors?
There's no doctors present. And it's very difficult to comment on individual cases because without actually being in the room or seeing what happened, it's very difficult for me to comment on what took place with your situation. And sometimes situations can arise where emergencies do happen. But as I said, the midwives are trained in dealing with emergency situations, such as the one that you have described. And it's worth remembering that our consultant obstetricians and our midwives, the registrars, all the doctors work together on emergency simulation training. So we all do the same emergency skills and drills together. So we have those basic skills that we need to handle that situation, make the appropriate transfer, and do so in a timely manner that is safe for mothers and babies.
So is that midwives when in 2014 when I had my daughter were trained well enough?
No, that's not what I'm suggesting. What I'm suggesting is in a different environment, and with the skills and drills training around that is a little bit different in the sense that we do the stabilization and then move to an obstetric unit should we need to do so. And again, I cannot comment on your individual situation as to what took place about that. It sounds like the midwives handled the situation appropriately, and we can certainly talk further afterwards about that.
I just can't help but worry for other mothers or myself in future, especially with me expecting a baby soon, that if I was to go into labour or another mum and they had a similar situation where the midwife had to run out and get a doctor, and Dewsbury and Pinderfield, you can't get there just like that, and I needed a doctor just like that. What's going to happen? What if something bad happens to the baby? Then who's responsible?
The situation is no different to having a baby at home.
Yes.
Because lots of mothers choose to deliver babies at home as well. So it's the same environment, because what happens normally is that the midwives, that's where it happens right from the time that you get pregnant. So throughout your pregnancy, you are risk assessed, whether you belong to the low risk group or to the high risk group. If you belong to the completely low risk group, then you have the choice of choosing to deliver at home to the standalone midwife-led unit. Don't forget there is an alongside midwife-led unit based at Pinderfields. And some mothers still choose to deliver in consultant-led unit because of the type of pain relief that they choose to have. So the low-risk mothers have different options that they can have. As I said, delivering in a midwife-led unit is in that environment whereby specialist midwife provide you that one-to-one care. There's no rushing out because you are in that midwife-led unit, and you're going to be cared for by the midwives. And what they are trained to do is to pick up any risk right from the moment it happens. So it's not that all of a sudden the baby when the baby's heartbeat drops, immediately there is a problem. That's not how it works. During labor, if you look at mothers, there is about 10 to 20% of mothers who do end up having an instrumental delivery like what you explained before the show went on, or a cesarean section. But it takes a while before it gets to that stage whereby the baby needs to be delivered immediately. And that is the time that they pick up right from the moment that things are not going right, and they will immediately arrange your transfer. So we have a very close relationship with the Yorkshire Ambulance Service, that the moment the midwife puts that call in, you get a level 1 service, which means that the ambulance is at the doorstep within 8 minutes, if I'm told. And so that will be an immediate transfer to Pinderfields Hospital. And during the transfer time, there are things that we can do to help the babies, like putting the mum on the side, giving some fluids, giving oxygen. All these will help. And, by the time, and usually the midwives will ring into the unit at Pinderfields Hospital. So the team at Pinderfields are also ready, and they are aware and waiting, so that we can then assess and decide what is. And majority of the time, as I said, by the time the women arrive in labor ward, things would have settled, and you would end up having a normal delivery in Pinderfields Hospital as well. So, as Caitlin quite rightly said, we have had an experience over the last 6 years at Pontefract, and our transfer rate for expectant mothers is no different to the national average. We regularly audit, as to the outcomes of mums and babies, and our outcomes and from audits has always proved that the transfers were all appropriate, and appropriate care were given to mums and babies. But the key is the risk assessment right from the beginning.
Absolutely. And just adding on to that, exactly as Chitra said, emergency situations very rarely happen just like that, as you described. There's usually a pathway that happens and is detected by the midwives early on.
I have to disagree, because after my daughter was born as well, I was actually lucky that my father-in-law came to visit me just after this happened. After I had my baby, she looked fine, she looked well. That night, I was changing her nappy. She got mucky, so I took her clothes off, and I was just changing her nappy. It was absolutely boiling in there as well, and she just went blue. Now, the nurses come in, and I was like, what's going on? And she's just picked her up, rushed her out of the room. I've gone running after her, and she's giving her oxygen because she'd gone blue in the face. She wasn't breathing properly. And that's something that nobody expected. What if that happens?
All the midwives
again
are trained
at
in
Dewsbury?
Yeah, and that's a legitimate concern, and I understand what you're saying. The midwives are all trained in resuscitation, and we have resuscitation equipment at Dewsbury. We would have handled the situation exactly the same as the colleagues did at Dewsbury Hospital. So there would have been no difference in the way that the midwives immediately responded to you and to your baby.
And the reason I was lucky my father-in-law came was because the nurse kind of put the blame on me, saying that I left my baby undressed, I wasn't paying attention, I was neglecting her, which I wasn't. I was changing her nappy. And I was a first-time mom. And when you're looking at a baby's nappy, I was like, what do I do here? And when they first do a nasty nappy, it's like tar. And she made me feel like a really bad mother. First, because I couldn't breastfeed either. They wouldn't let me home until I could. And I felt awful. And my father-in-law's walked in. I've explained to him what's happened. And he spoke to that midwife, had a right go at her. And she apologised, and she started talking to me like I was a normal person. But the experience I had was horrible. So hence I've booked myself at Pinderfields. And I think for mothers like me who may be worried, I think you have a choice, don't you, whether to book yourself at Pinderfield or Dewsbury Hospital. And if you've got worries like me and you're still not 100%, just book yourself at Pinderfield, where you know there's going to be doctors.
And I don't think that that's exactly the advice that we should be giving out to mothers, because the national research of which we've based these changes on actually suggests that women who are of lower risk, that means don't have any complications that would predispose them to having, needing doctors' inputs. Actually, the outcomes for the mothers and babies are just as good as an obstetric unit.
But if a mother is anxious, like I've been anxious through this pregnancy, with hearing about these changes, and for the first few months of this pregnancy, I had no idea what was going to happen to me. I had one consultant saying that I would have to go to Pinderfield, and I was like, why? And they read my notes and said it's because they used forceps, which was wrong. Nobody used forceps, so my notes were wrong. The only complication was they lost the baby's heart rate, so I needed cutting, and they were going to put a suction cup, which they didn't need to use. So rather than the doctor explaining to me, I was explaining to the doctor. I just think if you're anxious.
And I think anxiety is something that all new mothers have. And I understand that these changes are right now somewhat theoretical to a lot of people, and that is that they haven't happened yet. So it's very difficult to imagine what care is going to look like on the other side of the middle of September. But once we open up our birth centre, and we will hopefully be having the keys handed to us next week, what we're going to be doing is having a lot of open houses, meet the midwife evenings and afternoons, and it'd be worth mums who do have any questions or concerns to actually come down and have a look and see. What we do offer is highly individualised one-to-one care for women in labour. And as I said, when we've looked at the national birthplace study, of which all of our NICE guidance, that is what all hospitals adhere to, actually suggests that women do much better in a birth centre environment with no difficulties to their babies. There's absolutely no increased risk to babies being born in either an obstetric unit or a midwife-led standalone unit, but actually the mothers have better outcomes than they would do if they attended an obstetric unit. So the evidence doesn't really support the anxieties for a certain group of mothers. But anyone who's anxious, please just get in touch with myself, come down to the birth centre when it's open, have a look around, see what it's all about, and we can certainly answer those questions for anybody. But to just say to go to Pinderfields, I think would be the wrong advice to give.
Yeah. And I think it is important, your individual experience should not sort of like influence the wider audience as well, isn't it? Because I think they all should have the choice of sort of like coming into.
Like some people choose to have home birth.
Absolutely, yes.
But if there is a woman out there, a mother, feeling exactly like I am, who has had bad experience,
absolutely,
then for me, the best option was booking Pinderfield, because I knew there would be a doctor there if something went wrong, which makes me feel a lot better. So I'm not saying that all women, because everyone's got a choice, if you want to have a home birth, that's that's your choice. If you want to just have a midwife, so you go to Dewsbury Hospital, that's fine. But if you're really anxious and worried, the same way I am, then for me, Pinderfield was a better option. So maybe for yourselves, Pinderfield may be a better option.
And it may be
Maybe,
a better option.
yeah.
It may be a better option for some women, but for the women who are expecting to have normal births, that have had straightforward pregnancies, actually coming to a birth centre does improve their outcomes. There is less likely that they're going to end up with forceps, ventouse, or a cesarean section by attending the midwife-led unit. And as I said, it is difficult to imagine what it's going to be like. And we would encourage anyone who has any anxieties, please talk to their community midwives at your next appointment. Please look out for all of the advertisements about coming down to the birth centre, because lots of women who are in your position actually do change their minds once they come down and see what it's all about. We certainly know that from Pontefract, as Chitra rightly said. We've got 6 years behind us at Pontefract, which we've learned and developed. And so we know that once women come in, see the environment, meet the midwives, ask the questions, actually feel entirely comfortable about coming to a midwifery-led unit, whereas in a situation like now, they would never have imagined that was the choice that they would have made.
Yeah. But we would like to reiterate that, every woman has got a choice, just like how you have a choice of choosing to decide on in delivering. That's not the point. The point is you have the choice, but it's important to address the anxieties, and have that informed choice, that you're well informed that, what are the pros and cons of delivering at every setting. And then you can make your own individual mind up as to what is the best setting for you and your family. I think that's most important. But it is important, as Caitlin said, we have got loads of open days, and it's a brand new unit. All the midwives are very enthusiastic, and so are we. There's a lot of planning that's gone on with other services, as I said, including the ambulance services. So so there is, and we have got lots of experience from Pontefract. We have had 6 years of experience, and nationally there are several standalone midwife-led units which are working very well. Just down the road, we have got Huddersfield midwife-led unit, which is very popular amongst the community there. So there is, a lot of evidence to say it is safe for low-risk mothers to deliver at home or in standalone midwife-led unit. But, you will be risk assessed all the way through your pregnancy.
And you were mentioning about breastfeeding, and that's an incredibly important point to touch upon. One of the advantages of having your baby in one of our new birth centres, particularly the Bronte Birth Centre at Dewsbury, is that the midwives will be able to offer you that one-to-one support for breastfeeding. The midwives are incredibly enthusiastic, and we're also planning on putting on breastfeeding drop-ins with our specialist midwife. So she'll be coming once or twice a week to have drop-in sessions. And even if you can't attend one of those sessions, our midwives are available 24 hours a day, 7 days a week by telephone if you wanted to phone up and get some extra support. And what we'll also be doing and encouraging mothers to do is to come back in, or even come in from the community, even if you haven't had your baby there, and we can give you that support on the one-to-one so that we can ensure that you have successful breastfeeding. So actually it's going to help improve the breastfeeding outcomes for mums and babies by having that local service.
That's fantastic, actually. We'll just go for a quick break and we will be back. Do remember that you can ring the studio hotline on 01924 505 629 or WhatsApp and text us on 07460 809 218, and we will be back in a moment.
Broadcasting from the Al Hikmah Centre in Batley, West Yorkshire, you're listening to Radio IMWS. Are you running a business from home and need to move into an office, a place where you can confidently meet your clients, or maybe looking to relocate? The Al Hikmah Centre provides office space in a safe, secure and scenic location. With easy access, convenient location, free car parking and free Wi-Fi, hiring an office at the Al Hikmah Centre can allow your business to grow. For more details and special offers, call 01924 500 555 or email info@imws.org.uk. Get physical with great rates at the Al Hikmah Sports Hall in Batley. You can book a weekday daytime slot for just £18 per hour. Call 01924 500 555. Evening or weekend slots for just £38 per hour, and special discounted weekend slots available too. Call 07968 222 886. The Al Hikmah Sports Hall, the perfect place to get back in shape. It is related by Sayyidina Anas radiallahu anhu that the Prophet Muhammad sallallahu alaihi wasallam said, when a man marries, he has completed half of his religion, so let him fear Allah regarding the remaining half. The Al-Hikmah Nikah service launched by the IMWS aims to introduce prospective marriage partners to help fulfill this important aspect of faith. The service is open to unmarried Muslims who are permanent residents of the UK. For more information, visit our website at www.imws.org.uk.
Radio IMWS.
Broadcasting from the Al Hikmah Centre in Batley, West Yorkshire, you're listening to Radio IMWS. Are you running a business from home and need to move into an office, a place where you can confidently meet your clients, or maybe looking to relocate? The Al Hikmah Centre provides office space in a safe, secure and scenic location. With easy access, convenient location, free car parking and free Wi-Fi, hiring an office at the Al Hikmah Centre can allow your business to grow. For more details and special offers, call 01924 500 555 or email info@imws.org.uk. Get physical with great rates at the Al Hikmah Sports Hall in Batley. You can book a weekday daytime slot for just £18 per hour. Call 01924 500 555. Evening or weekend slots for just £38 per hour. And special discounted weekend slots available too. Call 07968 222 886. The Al Hikmah Sports Hall, the perfect place to get back in shape. It is related by Sayyidina Anas radiallahu anhu that the Prophet Muhammad sallallahu alaihi wasallam said, when a man marries, he has completed half of his religion, so let him fear Allah regarding the remaining half. The Al-Hikmah Nikah service launched by the IMWS aims to introduce prospective marriage partners to help fulfill this important aspect of faith. The service is open to unmarried Muslims who are permanent residents of the UK. For more information, visit our website at www.imws.org.uk.
Radio IMWS.
Assalamu alaikum and welcome back. You are listening to Safeeyah's Hour, broadcasting live from the Al Hikmah Centre. Do ring the studio hotline on 01924 505 629 or WhatsApp and text us on 07460 809 218 if you have any questions. And someone has text in, if I can just get to it. Given that Dewsbury has a large South Asian community, how does this affect number of women who are likely to be transferred to Pinderfields?
Well, we've done some modelling to look at how many people would be affected by this, and we know that about 40% of the women in the community will be eligible to continue to birth at Dewsbury, and then the rest will require the specialist care that is offered at the Pinderfields Hospital.
And that's because of lots of other medical problems, or they've had previous operations and things like that. So there is a strict criteria. So as Caitlin said, we estimate around about 40% of mothers, pregnant mothers, should be suitable for delivery at Dewsbury.
That just reminds me, if a woman needed a cesarean, if she was fine and she was at Dewsbury, and then how do you know if a woman's going to need a cesarean as well?
Well, you can't predict it in any environment, to be honest with you. So you were looking for, as we've said before and alluded to, that actually situations don't just happen really out of the blue, that we'll be monitoring all mums, just as we do at Pinderfields. We'll be monitoring mums throughout the labour, looking for things that will be telling us that something isn't progressing as the way we as should be. And most of the time, we know that the highest transfer that we do from a birth centre, any birth centre, is for something called slow progress. And that's when the body is changing, but actually the mum isn't getting ready to have her baby. And as I said, that's not an emergency situation, but one that would require more support. And so we would be transferring for those types of things. And as we said before, it is very rare the situation happens where it just happens right out of the blue. And so there would be time to go to the hospital and get you there in preparation for a cesarean section should anybody need it.
But if you have an elective cesarean section because the baby is lying in the wrong position, or you've had more number of surgeries in the past that your consultant is advising you to have an elective cesarean section, they will be booked for at Pinderfields.
Right. Okay. We were talking about the new birth centre before we went on a break. Is there going to be one at Pinderfields as well?
Yes, we'll be opening up a 6-bedded unit alongside the Pinderfields obstetric unit.
Would women need to book these rooms?
No, you don't need to book them in advance. And again, the same criteria for mums applies to all of the birth centres across the Mid-Yorkshire patch. So women can just ask their midwives and they will direct them into the right birth centre.
Right, okay. Right, is there anything else that you would like to add about the maternity changes to Dewsbury Hospital?
My only thing is, we've talked about the labour part of it. So you will know right from the beginning whether you're low risk or high risk, and your midwife will talk to you at every visit to say where is the best place for you, and you will decide with your midwife where you choose to deliver. So it's important that you stick to that place of delivery. So, for example, if you're under shared care between a midwife and a consultant, and if you're booked in to deliver at Pinderfields, it's important that you deliver in Pinderfields and not arrive in Dewsbury. And if there are any emergencies, always ring, and all the telephone numbers will be sent out to all the women who are booked under our care, and make sure that any emergencies, women arrive at Pinderfields and not at Dewsbury.
Right.
And I think it's worth mentioning that these changes are actually quite positive because it's giving the women in the local community all 4 choices of birthplace, which is what's been suggested by the national guidance. So women will have the option of home birth, a standalone birth centre, alongside birth centre, or an obstetric unit, which we're incredibly lucky to have. And what it does mean for women who do need the specialist care in labour or after their birth is that the doctors will be there for 98 hours of resident cover, which is a very positive move. And of course, we're on call and available for the unit after those hours. So it is an incredibly positive move for the population. Although it feels like a big change at this point, it is for the benefit of mums and babies.
I got pregnant at the wrong time, didn't I?
Or the right time, Safeeyah, or the right time.
If I just waited for everything to come into place and listen to everybody else's new experiences, it would have been a lot better.
We've also heard the positive changes, like all the women now across the patch will get the 98-hour resident consultant cover, the neonatal services. Some of the transfers are happening already, if the babies are quite preterm, they get transferred to Pinderfields. If the mums have some complicated medical conditions, then those women are already being transferred to Pinderfields. So what's happening, in small patches, it's now more sort of like focused, and is happening in a slightly bigger scale now. But these changes have been going on for some time now.
Okay, we've just got another question that's come through. If more women choose Pinderfields as a safer option, what realistic future would the birthing centre have?
Well, birth centres actually from Pontefract has been incredibly successful. We've had over 1,300 births there, and it's been proven a really popular local choice for women. And again, once I think people come into the birth centre, see what it's all about, have a conversation with their community midwives, with the midwives who are birthing, are going to be with you at the birth centre, I think the realities of the changes will be a lot clearer, and women will become a lot more comfortable with it. And certainly when we had the birth centre previously, about 8 years ago, alongside at the Dewsbury, it was incredibly popular with women. They loved the fact that it was the one-to-one care, the extra support that they got postnatally with feeding, the homely environment. They felt safe, they felt secure, and they felt very well looked after. I think Dewsbury Birth Centre has a very positive future.
Okay. People are skeptical because we feel the changes are financially led. Are they money led?
I don't think. I think that's. I think you have to look at the entire service in total. It's not completely. I wouldn't say that there is no financial aspect. There is a financial aspect to it, but you have to look at what are the specialist services that are now become available. That we've already alluded to the choice, for the women about the 4 different style. There's going to be specialist services, that's going to be available at all 3 sites, like the specialist diabetic clinics, preterm clinics. They're all now possible, and they are based at Dewsbury. They're still available there. as I said to you before, we also have to think in terms of our workforce and how to, I think it's, if you look at it nationally as well, what the pressures of the workforce that are available, the concerns with availability of the doctors and things. So overall, we feel that, it would be better for us to have a more specialized and enhanced number of workforce focused on one side so that we can give as best a care as possible for all the pregnant mothers.
Right. Just looking at the time. So, Catherine, would you like to come forward and speak about? I forgot what it was.
Early pregnancy.
Early pregnancy.
I'm Chitra and Caitlin's colleague. I'm one of the consultant obstetricians, gynecologists. I have for quite a lot of years looked after and led the early pregnancy unit with another colleague who's not here, Miss Dingra. Some of you might know her. So early pregnant, we've been talking a lot about problems in labour, which rightly preoccupies worry, but women also worry about symptoms of bleeding and miscarriage in early pregnancy. So we're very pleased to be able to, we've got funding to have a full gynecology assessment unit that will be based at Pinderfields. So we will also have a dedicated gynecology team who look after not just early pregnancy miscarriages, ectopic pregnancy, but also emergency gynecology problems. That doesn't mean to say that everybody has to come to Pinderfields. We will have provision for women to be cared for, diagnosed, looked after, closer to home. But it does mean that we can concentrate all the expertise and specialist nurses, and we will have dedicated gynecology consultant specialist available more of the time, and that all fits in with the plans that you've already heard about. And by having those plans, we've also been able to offer a better, more dedicated service for early pregnancy problems and gynecology problems.
When something goes wrong in early pregnancy, it's a very emotional time for women. What support will they be getting from the early pregnancy unit to help them mentally as well?
So that it will be open. It'll be open longer hours. We're going to be able to have more staff, so they can spend more time with the women. They can offer more counselling and follow-up appointments, and give advice as to where women can go and who they can contact if with the emotional fallout from an early pregnancy loss.
And, if you have investigations and if the pregnancy is a little bit further advanced and for whatever reasons, if mom have lost their babies, there are specialist clinics that we do offer for mothers to be seen, and whereby all the investigations that were done at that time, it is looked at and is seen by a specialist, and they go through all the investigation results with them and also explain to them what has happened and whether there's any plans to be put in place for future pregnancies to minimize the risk of that happening again. So there are some specialist clinics that are available, and they are available at all 3 sites as well.
Great. We've just got another question that's come through. A child of a friend was recently misdiagnosed and sent home, with later having to go to Pinderfields to have his appendix out. The child spent a painful week after being misdiagnosed. These seem to be happening more and more. Can the panel explain why?
Okay, well, I'm very sorry to hear about that experience. But from a children's point of view, I mean, part of the reason for centralising services is to ensure that children have greater access to a senior paediatrician and other senior doctors that might need to be involved in the care of that child. So surgeons, anaesthetists, those sorts of things. So having that all centralised on that one site means that access to get those sicker children diagnosed better and more quickly and get them the right treatment earlier on.
Yeah. Is there anything else that you would like to add?
I just wanted to add, about some of the central specialists. It's okay, I'm sure my voice was there.
Yeah, I can hear
you. We do have specialist services that are centralized already in Pinderfields, like interventional radiology, which is very important. It's for some pregnant mothers who can sometimes bleed quite profusely after delivery. We have already some services that are already centralized in Pinderfields, like cardiology services. And some mothers do need their input. So it is important to remember that there's lots of specialized services that are already focused, and having your delivery there, if you need access to those services, it's already available there.
When you were talking about these breastfeeding support sessions at the hospital, is it a group thing or can you do one-to-one? I mean, some mums would feel comfortable if it was just one-to-one.
Yeah, and we can offer both. And I certainly know that our breastfeeding specialist midwife is very happy to come and assess people one-on-one. So she's more than happy to arrange those appointments as needed if you're having particular difficulties. We do offer the group sessions because a lot of mums do enjoy the social aspect of coming to the breastfeeding groups, and just knowing that sometimes that they're not alone in what they're experiencing is sometimes a real benefit. But of course, if you're not comfortable with that, we can arrange one-on-one, either with our breastfeeding specialist or with the midwives at the birth centre. They'll be more than happy to either just have a conversation over the phone or arrange a time for you to come in and be reviewed. Because once you get to know your baby, you'll obviously know the times when baby's sleeping and when baby's awake. So we can work around you.
And with this being an Asian community, some Muslim Asian women believe that they are not to leave the house after they've had the baby for a certain amount of time. Yep. So for them, would the health visitor be able to help them with the breastfeeding if they felt they needed extra support?
Well, we have community midwives who can see you up to 28 days after the birth of the baby. So they can come and see you at home. We have specialist midwives who are specialists in breastfeeding. She can come out and see you. We also have maternity support workers who deal with breastfeeding, so that they can come out and have appointments and ongoing appointments with you. We also have Auntie Pams who also offer breastfeeding. And in the Wakefield area, we've got the FAB, Families and Babies. They offer support to women who may be listening in the Wakefield area. So there's plenty of support for mums out there without having to leave home. And certainly sometimes it is just picking up the phone and talking it through, because sometimes you can pick up these things, just little things on the telephone that we can help with. So there's all sorts of support out there for mums. They just need to have a conversation with the community midwife, and the community midwife will give all this information to mums.
Yeah. And talking from personal experience, after I had my daughter, with the experience I had at the hospital, when I got home, it was just too much to deal with. And when I spoke to my health visitor that was feeling down, I just wanted to cry all the time, she just pulled out a pack of antidepressants.
Oh, no.
And I said, no, I don't want them. I just want someone else to talk to, someone I don't know. And I was put on a waiting list and I couldn't do. I needed someone ASAP. What can women do in that situation when they get home and they just feel so overwhelmed and they just want someone else to talk to other than their own family and friends, a complete stranger?
Yeah.
Then what do they?
The community midwife can be an option, because you will have community midwife contact details. You'll have the contact details of the local birth centre, so you can always call the midwives there. There's also lots of national telephone numbers that you can ring. The NCT offers breastfeeding support, so there are numbers that people can ring. La Leche League, they also have some support. Families and Babies offer support, as do the local ones through Auntie Pam's. So there's lots of support that mums can contact you and get some support there if it is needed. And I would hate to have, that situation repeated. So if you ever have it, do give the birth centre a call. The midwives will help you.
And why do the health visitors think that it's okay to just pull out antidepressants?
I couldn't possibly comment on health visiting whatsoever. Health visiting is out of the remit. But actually, Sue is here, and Sue can certainly comment on that. Thanks, Sue.
Yes, that I find that quite strange that you had that experience, because the health visitors are trained actually to support and give that support and tell you what you can access. And it's really unusual that happened, because that really doesn't usually happen. They can get you access to, but that's usually antidepressants if that's needed, but that's usually via your GP. So, so that is not, that's not a normal experience.
Well, I did find it odd, because it's not what I was asking. So I did ring up the unit, and I had her changed for another health visitor, which made me feel better, because the next health visitor I got made me feel a lot
I'd be
better.
really willing to speak to you about that afterwards, because that is definitely not usual.
Right. Another message.
Mixing around now.
Sorry, but it seems more and more errors are being made at Dewsbury. Staff say they are stretched. I've heard a definite increase in people complaining about poor diagnosis, and these are people I know personally. It seems like there is a funding cut at Dewsbury already. Is this the case?
There is no funding cut at Dewsbury, no, and it's really difficult for me to answer that, because if that's your personal experience, I'd need to have more details. But if the host can give me your contact details, I'd be very willing to speak to you and find out more about that. But it's very difficult to answer that without any more details.
Okay, so person who texts that in, if you would like me to pass your contact details on to Sue, then do message with yes or no. I'm just trying to think, have I touched upon emotions? Pains? There's not much about pain relief, is there?
Pain relief is one that often comes up, and I think there's quite a misconception that if you attend a birth centre, you won't have any pain relief whatsoever, and that's not true. Actually, we do one of the biggest relievers of pain, so to speak, is your own body, and then also has having that support, that comfortable environment that makes you feel very relaxed, with caregivers who are giving the utmost to you, and one-to-one care actually is one of the biggest things to help support women in labour. We also offer pools, so we have 2 great big pools. Wait till you come and see them, they're gorgeous. And they're incredibly helpful for pain relief. They're not for everyone, but most of our women, around 60%, will access that and actually have very positive feedback around that. And for very few mums, only about 4%, we actually have something called Meptid, which is an injectable medication that can sometimes take off the ease of contractions. Surprisingly few mums would actually transfer for any extra pain relief. Only about 4% of mums would actually leave our birth centre to attend an obstetric unit for an epidural, which is an incredibly small amount. So it just goes to show how our support and the things that we do provide, active birth, being mobile in labour, water, the environment, and just the support really can help mums through labour.
Everyone's experience is different with pain, because my mum made me feel so confident that it wasn't going to hurt, because she told me when she had me and my brother, she didn't even know she was in labour. Right. She didn't feel much. When I got there, I was like, I'll be all right. I was like, all right, okay, this is painful, gas on air, not doing it. So I had the injection. Is it pethidine?
Yeah, you can have pethidine, yes.
Yeah, that, and then I remember falling asleep and waking up and screaming for an epidural, which it was too late. They couldn't give me one. So, yeah, just bear in mind, listeners, pain can be different for different people.
Quite.
Another message has come through. It really feels there is a difference between what we are being told and what is happening. The experience doesn't match the plan for many people.
I'm not really sure what that means.
Is that about the changes to the children's services, changes to the maternity, or changes to Dewsbury as a whole? If you are still listening, we have run out of time. So
if they want to contact any of us, we'd be more than happy to leave our details with you, Safeeyah, so that people can get in touch with us with any further questions. I know all the panel would be more than happy to speak to anybody who would have further questions.
Actually, if anyone do have any questions that they would like to ask Dewsbury Hospital, send your questions into Anissa at